Well, my name is Caroline Sahba. I'm the Associate Director of the Counseling and Mental Health Center at TCU, and I specifically oversee all of the substance use and recovery services. So all things alcohol and drugs, I get to talk about all day, every day with our students and their families and other staff and faculty. Well, substance use disorder is the term for the disease of what used to be called addiction. In the DSM-5, or Diagnostic Statistical Manual, there's criteria outlined for a mild, moderate, or severe substance use disorder, or SUD for short. The language that we use here is really important because using terms like substance abuse, like what was outlined in the DSM previously, has negative connotations. When you think of the word abuse, you think bad person, bad choices. It's really focused on how bad it is. Substance use disorder puts it in a more clinical and medical terminology where you can focus on the person with the substance use disorder and focus on treatment and recovery. What I wish parents knew about substance use on college campuses really is that it's different than when they were on a college campus or in high school even. The prevalence and the accessibility for all substances, alcohol, cannabis, stimulants, anything, it's just very, very high. And students are faced with choices. Do I use this or not? If I do choose to use, how much, how often? What do I like about it? What do I not like about it? There's a lot of choices involved. So for a parent to make a blanket statement like, well, I used in college, it was fine. What they used might not be the same thing that their student is using. So it's crucial to have open conversations with their student about, what are you thinking about using? What do you like about it? I know that's a weird question to ask, but you might be surprised about the answer that the teenager or the young adult might give. And then also, what do you not like about it? What are you trying to avoid? Talking about those risks openly and the things that the student might be desiring in their use is a really, really important conversation to have. Whenever a parent is thinking about talking to their teenager or their young adult or college-age student about alcohol or other substances, I think, getting past that awkwardness or like, this is taboo, you need to be talking about it because college campuses and young adults are inundated by messages of alcohol and other substances. It's all over social media. You sit down at a restaurant, the first thing they hand you is a drink menu. So they're aware, they see it, and they want to know what their parent or their caregiver thinks about it. They want to know facts. So saying something like, well, just be smart. What does that mean? Give context. Well, being smart means knowing exactly what you put in your body, how much, and how quickly. It's knowing that a standard drink is 1.5 ounces of liquor. Like, that's specific, and that is smart to know what they're putting in their body. Knowing not to take something that isn't prescribed to you because you don't know if it's laced, you don't know the dosage, and it's pretty dangerous to just trust someone who's handing it to you out of their pocket. I wish that parents would increase their comfort level in having those difficult conversations, saying things like, well, I know you're going to drink in college. That's giving permission to engage in something that maybe their student or child doesn't know anything about. So, giving that context, being specific, following up that be smart or don't be stupid comment with how, and being willing to share their own experience, even if it's not so pretty. I did choose to drink in college. This thing happened that I wasn't proud of, and here's how I would do it differently today. What are your thoughts on that? So asking open-ended questions is, I think, a really big part of that too. Not, you aren't going to drink, are you? Obviously, the answer should be no. But, what are your thoughts about alcohol? You're moving out of the house next year. What do you think you might do when you're at a party? And, trusting the child to make their decisions as they become an adult. It's a really scary but also really beautiful process.